Hi, I'm Dr. Aspen Goldsley, and today I'm going to talk to you about how you can find out whether you're caught in that symptom-based model of care. So first of all, what is a symptom-based model of care? Well, a symptom-based model of care is a model of care that's based on symptoms. So what's that mean? That means your doctor is treating basically your symptoms if you're caught in this model of care. And so just treating the symptoms includes things like cortisone injections, minor surgeries, total replacements. These things are not actually fixing the root cause of the issue, they're just masking symptoms. For example, if you're looking at a knee, and you'll see patients come in with this knee issues all the time. So when you look at a knee joint and you start to see arthritic changes in that joint, you know they've had a functional issue at least 5 to 10 years because it takes that long for arthritis to develop typically. But since it takes 5 or 10 years for that to develop, and they may not even have a symptom in that time, if you look at the disease process, this is the end of it, this is the beginning of it, this is where function is lost, this is where symptoms began. So you can see a lot of time passes before you even know you have an injury. Often initially when this function's lost, you might have a pain, and that's when you're given that symptom-based care where you're just giving a medication just to mask your symptoms. So when you're given that medication, it basically allows you to further degenerate down the line and eventually leads to a surgical procedure in most cases. So if you're looking at a knee, for example, this again is where they had arthritis in this knee. The issue was though that on this side the knee was tipping, so it was too close to this side because of a muscle imbalance issue. So when that muscle imbalance occurred, it pulled the knee down, causing friction in the joint space. So a symptom-based type of care would be to give this patient a cortisone shot to reduce that inflammation, to reduce that pain. But would we actually be helping the patient besides getting them out of pain? No, we'd actually be doing them a disservice because that patient is eventually going to end up further down the line of degenerative change. And why is that? Because a cortisone shot doesn't do anything to actually heal that tissue. What a cortisone shot does do is it does dry out the joint. It just increases osteoporosis by 4 to 8% at the site it's injected in. And it also shuts off your body's natural healing mechanisms that occur during inflammation. So your body's not healing. You've got a dried out joint with spongy cartilage that's getting damaged because this bone is rubbing against it, and you have a softened bone on a weight-bearing joint. So you're going to degenerate much faster in that type of care. Now let's kind of look at a function-based care model. So function-based care is basically trying to determine what's actually the root cause of this patient's issue. So, a simple x-ray, you could see that that patient had a malpositioning of the knee. So if that patient has a malpositioning of the knee, you've got to fix that malpositioning, because if you don't fix that malpositioning, you're not going to fix their problem. All you're really going to do is leave that condition going and get further degeneration. So if you fix this malpositioning, you stop the damage that starts occurring down there. Now if there's already damage, you may have to add other things like viscosupplementation injections or hyaluronic acid injections, or possibly some sort of regenerative medicine injection. So a functional based care model is going to lead to regenerative changes, meaning you're actually going to regenerate tissue and restore function to that joint. So I hope this was beneficial and you learned a little bit. Hopefully you're not trapped in this category here, this model. You want to be over here because this is, if you want to keep your joints and you don't want to get them replaced, function-based care is what you need. So look for more of my videos. I have stuff on Facebook and also on YouTube. Our website's coremedcenter.com. I hope this was helpful. Thank you.